Hi, welcome guys to the fourth episode of my Valerie Gehy podcast. Today we are going to navigate to the importance of health insurance. And we have our first guest today, our first expert, my friend Nathanaelle Vazquez. We are going to pour it all on you. Are going to talk about the challenge we face in the business, to educate you how to be smarter when you call us to enroll into the health plan. And gather around. Let's go ahead and do it. So today we have my friend, my colleagues. We have been in the business for almost a decade together. So we are going to give it all to you. So it's a privilege to introduce Nathanaelle. She goes by the name of Natu. And Natu, today, welcome to Valerie Gehy podcast. How are you today?
Hi, Valerie. Hi, everyone. I am super excited to be here. Happy to be here. Happy to share my experience.
Now, Natu, how long you have been in the business and how long we
Wow.
know each other?
Oh my God. We've known each other forever, and I
Yes,
have
that's
been
true.
in the business forever as well. I remember I started in 2015,
Yeah.
and I've been hooked ever since. So it's
Uh,
really it feels great to be able to be there for someone who needs health insurance to help them. It's an
correct.
amazing feeling.
On my hand, I always wanted to combine helping people and, of
Mhm.
course, making the chunk.
Mhm.
And I've truly, for me, think that I find my profound calling. It feels really awesome when you know you save lives. And what about you? What do you think?
No, it's the same thing for me. Like
Hmm.
I personal experience. My husband, he has a little bit of health issues, and I feel like if I wasn't there, like before when we started
Hmm.
dating, he was younger, he didn't care as much. And as I dive a little bit deeper into the health insurance industry, and I was able to get him a plan, and wow, like the difference that made. He before health insurance, he used to have like a whole bunch of bills. Like he goes to a
Hmm.
hospital, he goes to a ER, and he comes back, and after a month or two, bills will just keep coming in and coming in.
Yeah,
But he didn't care. He was younger. As he grow older and take his health a little bit more serious, then he realized the importance of health insurance. And I feel like I'm that one person that I was there to help him. I see him going through it, and I see him being so satisfied and with that relief, like, oh my God, I have zero deductible. I don't have to worry. I have zero co-pays. And it's amazing. It makes me feel like this is my thing. This is what I want to do. Not only for him, but for
hmm.
millions of other people who are going through the same thing. It's really
I'm
awesome.
happy that you are sharing with this because
Hmm.
when we take the mindset of a young boy or all the
Hmm.
young people out there,
Hmm.
they have the tendency to feel very invincible, like I'm invincible, nothing would
Hmm.
happen to me. And your husband is a true example that is not true, correct?
Hmm. Correct.
And as a young man, he faced health issues
Hmm.
without health insurance. And you came along
Hmm.
and say, hey, we are going to get you health insurance, and so we can compromise the bill that's coming in back and
Yeah,
forth, because in their
absolutely.
mind it's gonna go away. It's
Yeah,
never gonna go away. The
it
bill
doesn't go
was
away.
correct, it
It
doesn't go
doesn't.
away. So this is where the importance of having health insurance, this is where the young people, they have to know
Yeah.
the probability of having an issue or
Hmm.
the catastrophe that may hit, and when
That
what
is correct.
happened when you don't have health insurance. You
That
go
is
to the
correct.
health, you go to the hospital, you get treated,
Hmm.
but somehow someone has to get paid.
Yep,
And it
exactly.
and the bill is gonna come.
It's gonna
you
keep
know,
coming. You
it's
have to
gonna
get
keep
rid of
coming.
it. Yes.
Correct, correct, correct.
Yeah.
And if you don't pay, it goes to your credit. So,
Hmm.
somehow it's beneficial to have health insurance.
It's
Now,
very beneficial to have health insurance. I usually say,
hmm
when I talk to people who are younger who doesn't
hmm
know the importance, they don't understand. Oh, I'm super healthy, ha ha ha. And I'm like, okay, well, your car is awesome. Your
hmm
car is amazing. You drive.
hmm
You don't go in the road and you try to hit somebody. But guess what? You do have car insurance. It's a protection. If something happens, it happens, and you have it. You got yourself covered. It's the same
hmm
thing. Your
It's the
body
same thing.
betrays you on a daily basis. You wake up today, you feel great, you had an amazing day, you go to bed, and then you wake up the next morning and you feel like, okay, you know what? I can even get up today. So I always emphasize the importance of, having
Having,
health insurance.
yeah.
That's it. There's no other way around it. You have to have.
Correct. So for the car, it's a must, it's by law,
Mm-hmm.
but unfortunately for the
For the
health, it's
insurance, is it?
optional. It's
Mm-hmm.
optional, which is, it's not, you don't have to have it by law, but at the end of the day, you have only one body of yours that you need to protect, you need to defend.
Exactly.
So
Mm-hmm.
yes, so we are going to go through the key terms,
Mm-hmm.
also the challenge me and you face
Mm-hmm.
when when a consumer call us.
Daily
So
basis.
correct. So again, I'm gonna address when your husband had a zero deductible, the importance. The lower deductible, the closer to zero your deductible is better. Correct?
The
Natu?
best. Yes,
Okay.
a
So
hundred
you can
percent.
elaborate of that.
Absolutely. I myself, I'm one of those people. Thank God, I eat somehow somewhat healthy. I exercise whenever I can. I drink a lot of water on a daily basis. My cold is not the same type of cold for other people. I get haha, little runny nose, blah blah blah. I drink my tea and I'm really okay. So I remember I had a a plan with a carrier, and the deductible was 8250, and I'm okay. It was a bronze plan. It was a zero plan, and I didn't worry about it because I know myself. Like I'm like, I'm not gonna get sick.
I'm invincible.
I'm invincible, right? I was younger and I was invincible. I really didn't care. And what happened is I needed to had a minor procedure done. And unfortunately for me,
Mhm.
because of that beautiful 8250 deductible, I had to pay. It had to come
That
out
you
of my
are
pocket.
responsible for.
That I'm
Yes.
responsible for.
Yes.
And it was not fun because
Yes.
and that's when I realized my husband's like, oh, okay, I had a cyst removal, and guess what? I didn't pay anything. Wow. And as the insurance agent, I'm like, I should have done that. I know
You
that. I should have
yes.
gone with that. But guess what? Me thinking that I don't want to pay. Why? I don't want to pay because it's zero monthly premium and I have a deductible. I know I'm invincible
Mhm.
and, like I'm healthy and everything. So I didn't care. And the importance of having a zero deductible plan, I cannot stress that. It
The
just,
closer.
oh my
The
gosh,
closer to zero is the
the
best.
better.
Correct.
Because when you go to that hospital and they say, let me do it, let me give you an IV, let me give you a $500 Tylenol.
Correct.
Like, and then when you look at that bill, it comes, the statement, it shows, it's like, okay, you got this done, you got that done, you got this done, you got
And
that
it's
done.
not
And
fun.
oh
It's
my
not fun.
God. And it's
It's
like
not fun.
$0 because of your zero deductible plan. It's
Yeah.
amazing. It's a relief.
Correct.
It's a
Correct.
thing.
And also not to,
Mhm.
if you have to have a scheduled surgery, not a emergency surgery, a scheduled surgery. If you have a deductible, the doctor will say, "Hey, Valerie, you need to pay the deductible first before we go to surgery because it's not emergency. It's not emergency, correct?"
For deductibles,
Uh-huh.
deductibles plays a major role when it comes to hospitals. So if the person goes to
Correct.
a hospital, the
They will be
deductible is what?
served.
Correct. But
Correct.
for surgery, if the person has
Yes.
a scheduled surgery,
Mm-hmm.
it's more towards the max out of pocket, which
Mm-hmm.
also is included in the deductible. So it makes it,
Correct.
yeah, they
Correct.
go hand to hand pretty much.
They go
Yes.
hand in
Hand
hand.
in hand. Yep.
So we have the deductible and we have the maximum out of pocket. So
Mhm.
everything you paid, so let's say your deductible was 3,800
Mhm.
and now it's down to zero because somehow you pay some
Mhm.
co-pays throughout the year. That $38 is being deducted to the maximum out of
Out of
pocket.
pocket,
Correct.
correct.
So the
Everything.
maximum out of pocket means that this is the max you can pay throughout the whole year. Correct.
Yes, yes, that
Okay,
is
so let's say you have a surgery that is $1 million, you are subject to be billed. It's a protection, it's a cap protection. You cannot be billed
correct.
past the maximum out of pocket.
That is correct. I
Okay,
usually tell the people, the insurance lingo is not for everyone, right? If I'm speaking
yeah,
to someone who's never been in the insurance industry, I cannot say your MOOP or your max
no,
out of pocket thing. I go, your maximum out of pocket. It's kind of like a credit card. And let me just
yes,
explain it to you. Your credit card has a limit of, I use the same amount that the max out of pocket is. And I said, your credit card limit is $1,800. And if you have a card right now, you go shopping, 1,800, that's it. You can't spend anymore. The credit card company will say, stop. You've reached your limit. I said the same thing, kinda, with the company, with the insurance companies. They will tell you, stop. Now you done spending. Now let us cover you for everything else. As
correct.
opposed to the credit card, you have to pay it.
You
But
have to pay.
the whole analogy, it's like kind of the same. Like you have a limit. You have, this is where you need to just stop, and then we cover you for everything else. I usually use that, and it helps for the people who are not very familiar with the insurance lingo and stuff like that. So it helps. It really helps.
Okay.
Hmm.
So, and also we have what we call the copays and the co-insurance. So copay is fixed, guys.
Hmm.
I keep repeating it. It's fixed. So you
Hmm.
have a copay of $25 for every specialist. It's
Hmm.
$25 every specialist. You have a
Period.
25% co-insurance for our MRI test. It's 25% of the total amount, whatever the provider asks. Correct, Natu?
Correct. Yes, that is
Correct.
correct.
Correct. Okay. So now we can talk about the premium that varies upon income, demographic, and age. Household of income, demographic, and age. So let's say, for an example, Natu, like a 28 years old who make 30,000, it's subject to have maybe a
A
zero
monthly
or
premium.
20, yes, correct,
Uh,
$0 or $20 a premium is how much you are going to pay on a monthly basis, correct, Nata?
correct.
Now the same single person, 28 years old, who makes 65,000, there's no zero premium for you, correct? Yes.
No.
So the more money you make,
The
the
less
less
the
help.
subsidy, the
Correct, correct, the
I
higher is the premium.
also, if
Hmm.
it's okay, if I wanted to add
Yeah, go ahead.
something real quick.
Hmm.
Even with the deductibles, when it comes to the high monthly premiums or the high income, they do have the plans, on a tiered level. They go from bronze to
Yes,
silver to gold to platinum. Just because it's platinum doesn't mean it's better. It
it's
just
better.
helps. It
That's so true.
helps the people with high income. Like the gold,
Correct.
for example, is like the best for a 28-year-old
Hmm.
with a 60,000 income. The gold is like the best. Not only the deductible is there, but it's a lower deductible compared to the silver. So
Correct.
although with the lower income, the silver is like the first tier period. That's it, one and only. But the gold is there for our high income clients.
Correct.
So if you make 60,000, don't think, oh, I'm gonna pay $500 a month for my insurance, and then I have to have a high deductible, a high copay, high this. No, you may have to pay for your healthcare coverage, which is
Correct.
okay because it's
Hmm.
necessary, it's a necessity.
Hmm.
But know that you will also have some lower copays that goes along the way. So with the gold plan and the
Correct.
platinum, they're like the best when it comes to high income clients.
All right. And also, now to let's give an update about the laws, the new changes that we having in the marketplace right now.
Hmm.
Um, and we do we the marketplace have adjust upon the income, upon the age and the demographic, but
Mhm.
throughout the year, there's what we call um, special enrollment after open enrollment. And
Mhm.
what are the factors for you to be qualified for special enrollment? Do you want to
Mhm.
elaborate on that? Go.
Absolutely. The open enrollment is exactly what it is. It's open enrollment.
For
Everybody, welcome.
everybody.
The door
Yes.
is open. Come on in. Let's get
Yes.
qualified. Let
Let's
me
get
get you that
qualified.
covered.
Correct.
And the special enrollment is completely different. The
Correct.
special enrollment period, you have to have an event. You have to have something special that would
Yes.
qualify you to get that health
Life
insurance.
change event.
Life-changing event. That is correct. So it's not like open enrollment. Like I can just go in and say, hey, I need my
Mm,
coverage. I
no.
missed January or December 15th. I missed
Correct.
November 1st. I need to get my coverage. No, you
Yes.
have to have a special enrollment. In events, you may have a baby that's qualifying you. If
Correct.
you had healthcare coverage and you losing it or you lost it, that
Hmm.
also qualify you. You got
Correct.
denied Medicaid, that
Yes. That's
qualified
the
you.
most common one.
Oh
The
my
denied
goodness,
Medicaid.
yes.
Though this one, yes, is the
Medicaid,
most common one. Especially
very.
this year, a
Mm-hmm.
lot of people lost their Medicaid. I don't know, there is
Yes.
a new law, but a lot of people lost their Medicaid this year.
Yes, and the immigration status as well. That one
Correct.
is one of
M-
the most
Most
popular one. Why?
correct.
Because we do have, just like you mentioned, Val,
Hmm.
we
Hmm.
have that, the laws, everything is changing when it comes to
Correct.
government, and they
Yeah.
are doing some helpful things to bring in some
Hmm.
people in legally. And those
Yeah.
people, they come in, they have their employment authorization, they are starting working, they have their income, they're planning on filing their taxes, and these
Hmm.
people are in need of coverage.
Correct.
Gaining an immigration status is one of
Yes.
the
Yes.
qualifying events that will get someone
Correct.
healthcare coverage during SCB.
You have to have a legal status. You have to be able to work. You
Hmm.
have to pay, you have to be able to file tax the following year for you to be
Correct.
eligible for a state subsidy. So you
Correct.
have to have a social security. Bottom line
A
is
must.
there's
Yes.
no way around it.
Hmm.
It's you have to have a legal status. Once you have,
Correct.
and for you to have the legal status, you have to have a social, you have to have a work permit that makes you legal in the territory for you.
Yeah.
So, Nato, I wanted to talk about the HMO
Hmm.
and the PPO. So those are the two major network in the field. So I always said HMO, it's a limited access. You have
Hmm.
to go where the plan takes you, and you
Hmm.
obviously need a referral from your primary to see any specialist. And that's something sometimes, it's annoying. And then the PPO, you have the largest network, you have the flexibility to see your own doctor, and you don't need a referral to see a specialist. I also said if you think that you're gonna see the doctor once a year just to address your preventative care,
Hmm.
and then it's bye bye Felicia, so you might as well go with the HMO.
Hmm.
But if you do have some severe pre-existing condition, cancer, heart disease, I I will recommend the PPO just for the sake of you having several opinions from several providers. What do you think of that?
I think it's great. We have three major networks, which is the EPO. I see
Hmm.
that you forgot to mention.
Yes,
Um, the
the big one,
EPO, exclusive provider
providers.
organization, and there's the
Yes,
PPO, and there's the HMO. I
correct.
love the EPO. Why do I love the EPO? Which is majority of the plans in the health marketplace. It's
Yeah.
HMO and EPO. The EPO gives you the flexibility. Not only that you don't need a referral to see specialists, you can travel outside of the state. If you travel outside of the state, as long as you remain within that network, you can use it for up to 1 month in case of emergencies. That is
Oh,
amazing. The PPO does not do that. The PPO, the only thing the PPO does, it gives you the access to go out of network, which is the EPO does that too, but you cannot use it outside of your state, even if you have an emergency.
So what will be the difference between the EPO and the PPO?
That's it right there. Like
That you can travel with the EPO?
you can travel with the EPO.
Can. Okay.
You
Uh-huh.
can travel with the EPO. You can use it up to 1 month, only 30 days in case
Out of
of
network.
emergencies, out of network,
Correct.
within network, I'm sorry, within network. So for
Okay.
example, if I'm
Mhm.
here in the
Mhm.
state of Florida, and let's say I
Mhm.
have Florida Blue,
Uh-huh.
if I go to New York or if I
Uh-huh.
travel to Georgia, I have
Mhm.
to stay within the Blue Cross Blue Shield network, if
Okay.
that makes sense. And I'm using the carrier's name not as a preference, but just for reference purposes. So again, Florida Blue here in the state of Florida, even though it's the mother company is Blue Cross Blue
Mhm.
Shield,
Mhm.
but here in the state of Florida, it's called Florida Blue. If I have an EPO, Florida Blue, I go to Georgia, something
Mhm.
happens, unfortunately,
Mhm.
and I
Mhm.
need to go to the doctor or I need to
Mhm.
be
Mhm.
in the hospital. I need
Mhm.
to find a hospital which the Blue Cross Blue Shield network,
Okay.
period, is there.
But the key word you said, emergency. Not to go and
Correct.
take care of your preventative care,
No, no, no,
not
no.
to go and pick up your medication,
That is correct.
not to say, hey, I have a
Mm-mm.
headache here, I need to see a doctor. No, no,
Correct.
no. Out, we're talking about emergency room, like you
Correct.
break a leg,
Correct.
or you
Something
have,
happened, an
okay,
accident. They had to
okay,
rush you to the
accident.
emergency. You have
Correct.
to be there, but
Okay,
they will cover you for up to 1 month. And
okay.
after that 1 month, they will ship you back to your
To
state
the
and say,
state.
"Hey,
Okay, okay,
let's take you over there so you can
okay.
continue treatment."
But not the HMO and not the
Not
PPO.
the correct. The
Okay,
PPO, yes, you don't need referral to see a specialist, which is also with
okay.
the EPO, but
Yes.
you cannot leave network when it comes to the PPO. The HMO is exactly like you said. That's it. My
Yeah.
primary
Okay.
care doctor is my personal, literal, like my parents. I cannot do anything without asking my primary care doctor. If I need to see my cardiologist,
PCP,
my
primary.
PCP, my primary care need to know, and they need to give me that referral. Like, oh my
Yes.
God, you have your heart is beating faster than normal. I need you to do an electrocardiogram. I'm gonna give you this referral, and you go see that person. That's how the HMO works. The EPO and the PPO give you more
Yeah.
freedom. I love it.
That person, I referred you to that person. The
I'm
person I
referring you.
referred you. Correct.
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 So, what do you think about the people that have the severe pre-existing condition? I'm not talking about cholesterol, diabetes. I'm talking
Hmm.
about heart disease, cancer. What do you think of them having several diagnosing for several providers? So they would, I would suggest, the PPO or even the EPO for them to have a larger network.
I actually agree. I
Okay.
agree 100%. And again, using my husband as an example,
Mm-hmm.
he has a primary care doctor and he had an HMO plan. Unfortunately, your doctor is not the one who take care of all those little paperworks and
Mm-hmm.
like those referrals. Those
Mm-hmm.
sometimes the front office are not as proficient. They're not
Yeah.
as fast as they need to be. And somehow, sometimes it's understandable because there's a whole lot of people coming into the office that they have to take care of. But the HMO normally gives their patients a lot of problems. Some people don't have a problem with it, which is okay. But people with pre-existing conditions, such as like you mentioned, heart disease or anything more severe, more like you know perturbed, you have to get a plan where you can have an like freedom to go,
Mm-hmm.
because
Correct.
anytime something can happen to you, you
Mm-hmm.
can go to that specialist that you already have in network
Yeah.
and you can see it without having to wait on that permission, that little slip from
Yes.
the carrier
Yes.
and from your doctor for you to see treatment. So my husband again is number one example that I want to use. Like, the EPO is his preference. Why?
Is it
Because at any given time, his doctor can say, I need you to see a cardiologist, for example. And he's like, okay, I have one in network. All he had to do is just call, make an appointment, and go. No
okay?
referrals needed.
No referrals, really. And
Hmm.
then now also, what is your take when a consumer call,
Hmm.
they are not equipped, which is with the information.
Hmm.
They just called just to be enrolled, but they don't have the information. They don't ask the correct question. They do have a doctor that they don't want to change. They don't provide the information to the agent. We don't, on the other line, don't know they have a preference of doctors. We don't know they have a specific medication with a specific milligram that we have to check the tiers. This is the profound ideology of the podcast, to educate, for you to be more savvy and smarter when you talk to an agent, and hopefully it's us. Okay, so I'm going to show you our typical day when we are on the phone, when you call and we are ready to serve you. So here we go.
Um,
Mhm.
this is Natu speaking, Enrollment Center.
Hi, Natu. I'm looking for health insurance.
I'll be happy to assist you with that. And who do I have the pleasure of speaking with today?
My name is Valerie.
Hi, Valerie. How's your day going so far, Valerie? You don't sound too excited, too happy.
It's not important, but anyways, let's go.
All right. I'm gonna aim to actually make your day a little bit better today and assist you in getting an amazing plan,
I'm
hopefully.
in pain. I don't have health insurance, and life is hard.
I am so sorry to hear that. Let's start. I'm
Okay.
just gonna ask you a couple of questions just to get you qualified. And to begin, I wanted to know if I can please have your zip code.
Yes, 33321.
Thank you, Valerie. And when you file your taxes, Valerie, do you have any dependents, any children?
No,
Awesome. And if I may please have your age or your date of birth.
35.
Thank you. And are you currently married?
I'm not married. I'm
Single. All
divorced.
right, Valerie, you should travel a lot. Oh,
Yeah,
I'm sorry
right.
to hear that. I'm sorry to hear about the divorce, but yes, traveling is always very therapeutic, and it will definitely help you go through everything that you're going to. I can tell. And just to tackle back on the quote, Valerie, are you currently working?
I'm looking for a job. I just lost my job.
I'm so sorry to hear that. When it comes to you are in the state of Florida based on the zip code you provided, and
Mhm.
every single state have their own requirements when it comes to the income. The threshold for the state of Florida is 15,000 for a household size of one. Is there a possibility, or are you currently looking for employment, Valerie?
Well, when I lost my job, my last paycheck, my year to date was already at 17.
So we are definitely gonna be able to move forward with that. But I need you to do me one favor, and which is very important, to avoid any fees or penalties in the future. When you
Hmm.
start working again, Valerie, I need you to give me a call. We are definitely gonna remain in touch, and I'm gonna provide you my contact information so we can keep in touch. You have to give me a call. We have to update that income. So we are using the 17,000 because that's what you currently have in hand. That's what you currently
But
have made for
hold
the
on,
year, okay?
Natu. If I've got a job, if I get a job, I'm gonna be going under my group plan, or do I still have to stay with that plan?
No, if your company, if your future job offers you healthcare coverage and you're paying less than 10% of your income, then we definitely need to cancel that one that we're about to get. But if it's a
Okay.
little bit more, you can actually opt out and we can keep the one I'm about to assist you in getting. Okay?
Okay. So do I have to adjust my income? Do I have to call and do an income
You
adjustment?
absolutely have to. Yes. You
Okay.
have to
And what's
adjust your
gonna
income.
happen? If what's gonna happen, am I paying more or less?
Well, we don't know yet. We have to move forward
Okay.
with the quote, and I will tell you the amount of subsidy you qualify for. But when it comes to the income, it plays a major role on your subsidy.
Okay.
I'm not sure if you're familiar with this, but the subsidy is the tax credit provided to you by the government to assist you in getting a plan. Sometimes, based on the income, it could be $0 per month or very low monthly premium.
I
Okay,
just
so
told you I did 17 for the year already,
okay,
as of now.
17 is absolutely great for example purposes, of course. With 17,000, Valerie, before I even dive a little bit deeper into what
Mm-hmm.
I have for you, I want you to know, do you have any health condition? Do you go to the hospital very often? Do you have any planning procedures or surgeries in the near future?
I don't know about the surgeries, but yes, I do have a heart condition, and I
You
need
have
to see a cardiologist ASAP.
Do you already have one that you're currently seeing or you have seen in the past?
So I have Dr. Such and so that used to take my employer's plan. So
Okay.
I don't want to change. I would love for your plan to cover him. Is that
I
possible?
I can definitely look into that for you. If I may ask, Valerie, who was your carrier when you had your employer plan? I want to see if I have that same carrier available for you, and maybe you can stay with that same doctor.
All right, so with my employer, I had Cigna, but I lost
Okay.
it within the 90 days grace period
Okay.
after my
Okay.
employment.
All right, let's see what I have for you. Valerie, bear with me one moment. Based on the information you provided, you actually do qualify for a tax credit. Again, the tax credit is the subsidy that is provided by the government to help you get an awesome plan. And considering you mentioned to me that you had Cigna before, you have a cardiologist in network that you want to keep, I do have a Cigna plan available for you. And based on the income, of course, it's showing me that it's an EPO plan. Most Cigna plans are actually EPOs. It's an EPO plan, which means if you need to see a specialist, your cardiologist, you won't need a referral from your primary care doctor to see that specific cardiologist. Your primary care doctor visits in network or $0 copay. If you need to get any generic medications, it's $10. I'm sorry, it's no charge. If you need to see a specialist, that cardiologist that you want to see, Valerie, it's only going to cost you $10 copay. Your mammogram, your pap smear, your colonoscopy, your vaccines, your flu shots, those are all part of your preventive care, which means things that you get done once a year. So you don't have to pay for that. You're fully covered. You don't have a deductible with that plan. That means if something happens with a heart condition that you say you have and you have to rush to the hospital, everything that in there for you will be fully covered. You don't have to pay. And the best thing about this plan is just like I mentioned, when it comes to subsidy, it plays a major role in your healthcare coverage. And I'm not sure how much you used to pay at your job, but I know for the jobs they're a little bit expensive coming from your income. But with this plan, since it's through the Affordable Care Act, your plan is actually going to cost you $20 per month, covering everything.
Now you're speaking my language. Okay. So $20 a month and everything is zero.
Not everything is zero. Not everything is zero, Valerie. Let me just clarify for you one more time. You don't have a deductible. That means if something happens, you go to the hospital, you're fully covered, right? But you do have something called maximum out of pocket. The carrier says they're gonna let you spend 1,800 toward everything, co-insurances, because sometimes you do need certain procedures done, like let's say you need a stent, for example, and they say you have to pay 20% co-insurance. That's part of your max out of pocket. So if it's, for example, Valerie, if that stent will cost you, let's say the copay or the co-insurance is only $800, and that leaves you with 1,000 left to spend. But that doesn't apply towards your copays. If you need to see a primary care, you still don't have a copay. If you need generic medication, it still doesn't affect that, and your specialist is still gonna be $10 copay. You just have that little cap.
Mhm.
Like I mentioned before, it's kind of, like the insurance says, help me out. I'm gonna cover you for $1 million, but I need you to help me out with only 1,800. So is that something you can do for me? So when you have that surgery, when you have to stay longer in the hospital for, something specific, are you able to help me by spending 1,800? I'm covering you for your doctor visit. I'm covering you for your generic medication. You can only pay $10 to see a specialist, but help me out. That's the cap,
Okay.
1,800. So not everything is free. I just wanted to clarify, okay?
Okay. Is that a silver, gold, platinum, bronze? Which one is it?
It's an EPO. It's
Uh,
well, the silvers, they're more like networks. So they
Okay.
don't go by tier, they go by network. So there's Cigna Connect and there's Cigna I can't remember the names right now because I don't have it in front of me, but they go by network. So that network
Okay.
that you have, it is Cigna Connect, and it
Okay.
is an EPO, and it gives
Okay.
you the freedom. Oh, I forgot to mention, Miss Valerie, if you travel, Remember I told you traveling is actually very therapeutic. If you decide to travel and go somewhere to have some peace, like, enjoying yourself, you can actually take your healthcare coverage with you in case something happens, because you do have a heart condition and that needs to be taken seriously. So always carry your card with you. If something happens while you're in Georgia, for example, you can still use it in case of emergencies, as long
If
as you
I
remain
can
within
go
that
see
single network.
any doctor, any cardiology, or something has to happen to me, emergency or anything. I can just.
In case of emergencies, all name is Valerie.
Oh,
No, you
okay.
cannot go to,
I'm
to
have to
Georgia and
ask.
see
I
a
don't know.
specialist there. It will not cover you for that. But emergency purposes, they will
Okay.
stay with you for up
Okay.
to 1 month. They got your
Okay.
back for up to 1 month.
Okay.
Okay, and to
All
move
right, Natu,
forward.
you got me. What do we do from there?
Awesome. To move forward with the application, I'm gonna need the full first and last name, please.
I feel a privilege. I feel so humble for you to be here and,
Oh,
you know,
I'm happy to
pour it
be
all to
here.
us. Yes. And so, what is your last takeaway of this?
This is amazing. I really love it. I love to educate people when it comes to health insurance. I have talked to a lot of people over the past 20 million years that I've been into the insurance industry, and it saddens me sometimes that they say certain things that they're not really knowledgeable about, but they are sure that it's actually correct. So that podcast is actually very um, educative. It helps people understand insurance. It tells you what to do, what not to do, what to get, what not to get, and how to get it and when to get it. So I really like it. I feel really happy about it. I'm hoping that we have a lot of people watching, because it's very educative to the best of our knowledge, which continuously happen on a yearly basis, daily basis. The industry changes, and as it does, we need to adapt to it. We need to, continue learning and see the changes and learn about the changes and educate people about it. So I'm really happy to be here, and hopefully, anything I said, people take it seriously. Anything you say, they listen and see the benefits of having health insurance and giving us a call so we can help them.
Yes, of course. And would you come again?
Yes.
Thank you so much for watching, guys. I hope this episode was very knowledgeable. I hope that your takeaway was something that you didn't know in the past, and now you're gonna apply it through your journey. I want to thank Natu for coming and also share all her knowledge and her tips and comments. Natu, where if someone want to talk to you, where can they find you on social media?
I am actually in Instagram. I'm on Instagram and my handle is NV, and for Natu, V for Vasquez Insurance Solutions.
All right. Thank you, Natu, for coming. It was a pleasure. I'm very humble about your presence, your takeaway, and your tips. On
Thank
my
you.
hand, don't forget to go on my website, valeriegehy.com. Don't forget to stay tuned, share, and likes Valerie Gehy podcast. And don't forget, where we're empowering you one policy at a time. See you in the next episode. Bye bye now.